to the NHS's post-COVID recovery programme. But social care is promised an extra £5.4 billion out of that pot. Services are under strain now, though, as a result of the pandemic, staff shortages. Let's talk about where need is greatest within the system. I'm joined now by Dr. Jane Townson, who's the Chief Executive of the UK Homecare Association, which represents those who give care in people's houses rather than in a setting like this. And now I should say before we begin that the social care finance plan is UK-wide. Health and social care is devolved, so each nation will implement the changes differently. Dr. Jane Townson, good morning to you.
Good morning, Aga.
Morning. OK, how do you feel about last week's announcement?
Well, in home care, we're bitterly disappointed. The government has given the lion's share of the money to the NHS and left 5.4 billion over 3 years, so 1.8 billion for social care. And we're currently facing the worst workforce shortage that anyone can remember in history. And these reforms do nothing to address care worker pay, which is at the root of many of our issues. We're unclear about the detail of many of the announcements. So it feels at the moment as though it's weighted in favour of the 500,000 people that are in hospitals and care homes at any one time versus the 15 million people being supported at home, needing or receiving support at home. So we're struggling to see where the benefits are. The asset thresholds have changed, which in theory should mean that more people are eligible for state-funded care based on a financial assessment. But unless more money is given to local authorities, they will have a similar pot to ration between even more people. So that could mean that fewer people or the eligibility criteria will go up and up. So until the government clarifies exactly what money it is making available, which it isn't clear at the moment, and when, we're feeling very concerned. And also, the reforms are geared towards helping people avoid having to sell their homes to pay for care homes. And we understand for those people that's important, but there's probably only about 20,000 people that applies to out of 400,000 care home residents. And it's care workers' pay that's going to suffer as a consequence of the increases in national insurance.
Let me talk to you about Steve in Hampshire, because he's asking why we're not talking about young disabled people who live independently at home. And people are getting in touch today saying that social care isn't just for elderly people. And, just as you were talking about, it's the tentacles, isn't it? Like everything that's affected from local authority spending to individuals as well. This demonstrates, doesn't it? This is such a huge sector, and without any clarity that you say you're desperate for, it's very difficult to move forward with a real focus.
That's right. And I think it's worth pointing out that there are more people, more jobs in home care, 735,000 jobs in home care compared with 680,000 in care homes. But the way that government and the media typically talk, anyone would think it was just all about care homes. And Steve in Hampshire is quite right. 50% or almost 50% of the current social care budget is spent on people under 65. And many of them have family carers that are, on their knees trying to support as well as holding down various jobs and so on. Or some of them have had to give up their jobs altogether. And there's nothing yet in the proposals to support the people, the unpaid carers. There's nothing to support the paid workforce, apart from, £500 million, which sounds a lot of money. But if you divide that over 1.5 million people in the workforce, that comes to about £100 per person per year, which government says is going to improve qualifications and training. Well, even supposing that that's true, once somebody's got better qualifications, there's no means to pay them any more money to reward them through an improvement in salary. So it's unclear whether, that's really going to help us. And, there's no real conversation yet about how we could, how this is going to help people out there access support when they can't at the moment. It doesn't look like it will. So I think we just need a lot more data and detail from the government. At the moment, we can't get basic facts. So it's quite a challenge.
Well, I wish you well, Dr. Jane Townson, who's Chief Executive of the UK Homecare Association. And hopefully Stacey has texted in. Hopefully your comments are helping with us as we address this subject, as much of it as we can.